So the first research paper to go over is the one conducted by Wang et al., which was the use of etoposide plus cisplatin chemotherapy. So a little bit of background as to why this study was conducted was that it was found through statistical data that people who developed small cell lung cancer, also referred to as SCLC, was the third highest ranking disease for people who had cancer, and by the time they realized they had it, they were already progressed into an extensive stage. Furthermore, it had such a low survival rate at only 2 years. So pretty much the study had 53 patients who received the etoposide plus loboplatin chemotherapy regimen, and then 59 of the patients received etoposide plus the cisplatin. So pretty much all this was also measured through the quality of life, which was then measured by what's known as a Karnofsky Performance Status Scale. This performance status scale essentially just looks at a cancer patient's overall well-being and their ability to perform everyday activities, and this essentially dictates if they are capable of receiving certain chemotherapy treatments. So it was found that no matter what treatment the patient had received, that they had a similar response, disease control, and progression rate as those in the other group. So for example, people who received cisplatin were essentially the same as the people that received loboplatin. Now as for that 2-year survival prognosis I mentioned before, between these two groups, it was not really statistically significant between the two, but it was noted that people who received the loboplatin treatment had less side effects or adverse reactions than those people who received the cisplatin treatment. And then as for the KPS scores, people in the etoposide plus cisplatin group had a higher Karnofsky performance scale rating after 6 cycles of treatment compared to 2 cycles of treatment. This will be mentioned more in the discussion portion of the presentation. However, it could be assumed that the cisplatin was more successful in its ability to treat patients.